Parenting a child with special needs can feel like you're constantly pushing through barriers. But it's a journey filled with love, often marked by isolation, unanswered questions, moments that make you question if you're doing enough. Breaking Limits podcast is a safe space that tackles the parent experience. For parents ready to trade isolation for inspiration or confusion for clarity, real talk, real tools, real breakthroughs. Where we hold conversations, ask the hard questions, and remind you that you're not alone walking this path. I'm your host, Dr. Vivienne Pierre, physical therapist, advocate, fellow warrior. On this journey, I'm excited to share these conversations with you that are so close to many of your hearts. I welcome you to the Breaking Limits podcast. Have you ever felt unheard in a doctor's office or confused by the system or unsure what the next step should be for your child? As a physical therapist for almost 2 decades, I hear this from so many families. The confusion, the overwhelm, the imagining what care should be and what it actually isn't. With policy shifting, insurance conflicts, unclear diagnoses, even questioning yourself as a parent or even as a caregiver. I am in the healthcare field and it still baffles even me at times. I recently visited my home country in Trinidad and Tobago, as you guys know, and met with individuals struggling to get answers for themselves in less than a perfect healthcare system. Because when the system feels like it's working against you, the truth is family care has to start meeting you where you are. Welcome back, families, to the Breaking Limits podcast, the podcast, as you know, that rewrites the narrative for parents of children with special needs. It isn't another show. It's just a safe space for the true parent experience where we talk about the hard things, where truth meets hope, where we're reminded that you definitely are not alone. There are other warriors out here with you. The space where we speak the unspoken, we try to honor your journey of parenting a child with neurological differences. I'm your host, Dr. Vivienne Pierre, physical therapist, advocate, coach, investor, and fierce believer that our children are here to show us what's possible and not what's broken. So we're here to break the stigma and most of all, break the limits of what's possible. Today's conversation is one that I've actually been really looking forward to. We actually had to reschedule this one, and I am so happy that we are back because our guest represents not just expertise, but heart, community, and real support for families navigating these complex journeys. And let's be clear, it's becoming harder and harder to raise kids, more so in these times today and in this special environment that we have today. So how parents can navigate the healthcare system with more confidence when it feels overwhelming or even stacked against them, right? So I'm so honored to welcome Dr. Jalan Burton, known as Dr. J and lovingly called Mama J by so many families, right? We're going to dive into the world of family-centered pediatrics, healthcare worker wellness, early identification, community education, all the things, why it matters, and how empowering you guys and all the providers can fundamentally change healthcare outcomes across generations. Right, Dr. J? I'm going to let her tell you about herself a little bit, but she is a pediatrician, a wife, a mother of 3, a graduate of the University of Virginia with a master's in public health from Columbia University and a medical degree from George Washington University School of Medicine with a pediatric residency that she did at the University of North Carolina primary care program. Dr. J, over 15 years of experience. You don't look at Dr. J, but in medical education, nutrition, pediatrics, children with special needs, complex care, youth development, all the things. Now you guys know why I'm so excited to have her. More than 7 years of professional coaching and consulting and over 20 years of peer health education experience. She's a teacher, a mentor for over 12 years, working alongside the doctors, the doulas, the chiropractors, the therapists, the physicians, all the people, bringing them all together, helping them sharpen their skills to help them help you in a completely different way, to help them be better leaders, scale, be sustainable, value-driven practices. She's the founder and CEO of Healthy Home Pediatrics, and she is deeply passionate about prevention, early diagnosis, equipping parents with the tools, confidence, and education, guys, that you guys need to support your children. She leads impactful group classes for families offers parent education and support programs. This is what we've been talking about over the last couple of weeks. Create spaces where families and healthcare workers can truly thrive. She helps her clients in what we know is a broken healthcare system. So we're going to talk about why early identification and parent education matters and what you guys can focus on, what care can look like when you truly meet the families where they are through home-based and community-centered type support. And we're looking also most specifically at how policy, insurance, funding, all these things that are happening right now in real time are impacting these families, what you guys can do to help yourselves, to help your kids, to navigate this new thing. So, Dr. J, that's a lot. You are doing so much stuff. So thank you for being here. I'm so happy that we get to connect, but I said a lot, but I want to hear from you. I want you to tell everybody kind of what even brought you into this space, into the pediatric space, because you are super passionate about this space. You have a journey that has led you to do your own home care and home health business. And I want people to understand why that was so important to you. So I would love for you to share that.
Thank you. I have come to just sit and listen when people introduce me. I'm always like, it's too much.
Like, is this me? Is this me?
It's too much. But I think it's like submitting to the amazing, I guess, weaving that the universe does in our lives. Like, I am truly led by how can I do the most good? How can I use my skills and my services and my voice to make the biggest impact, and that is for the good, for my family, for my community, and for for everyone, because we're all connected. So I mean, I am one of those people that always knew they were going to be a doctor. Like, I was little. Like, my mom and dad were like, I was literally like 3 or 4 years old, and they tried to give me like a nurse Halloween costume, and I was like, no. I was like,
no, that's not for me.
Doctor outfit. And so my mom made, like, she's my mom sews, and so she took the nurse's uniform and made it a doctor's uniform and gave me a doctor's bag, and like that's my like first Halloween costume where I was like, this is what I want. So I think especially Black providers, especially women, we go into medicine because it is part of our social justice practice. It is part of my rent for living in this world, right? Like, I am a really good pediatrician, and I'm like, this is what I'm good at. Let me do this. I've spent hours and hours and thousands, tens of thousands of hours doing this. I'm really good at it. And so I always knew that I was going to be a pediatrician. But when I got to high school and I'm an avid reader, and I started reading about healthcare disparities and just how things were getting worse and worse, I was like, wait a minute. We got more and more and more doctors, but things are getting worse. Like, what's going on here in America? And so it was really in high school that I just started reading a lot of medical anthropology, a lot of like sociology of medicine. And I just saw, the impact of inadequate care in my own family. Like, I can remember going to the doctor with my grandparents because, being one of the people that is health literate, you start being the person that goes, grandma's going to the emergency room, go take her, her blood pressure's too high.
Right. You're the go-to. You're the go-to.
Yeah, and I would see, I saw just this shift of how people would interact with my grandparents as soon as they were like, hey, they would ignore them, be like, oh, did you take your medication, be super disrespectful. And then as soon as they were like, my granddaughter's in med school, it's like,
switch.
And now I'm going to be nice. And now I'm going to explain things. And now I'm going to go above and beyond for grandma. And I remember being like, this is the health disparities. This is the bias in medicine. Like, this is all the stuff I'm reading about. And so that's what prompted me to get my degree in public health, because I was like, how can we go above and beyond what happens in these individual rooms? Because again, things are getting worse. And then flash forward to today, right? I've been in practice for almost 20 years. Things are worse than it was when I started. Healthcare disparities in America are further entrenched. Income inequality is further entrenched, right? Like, we've got the CEOs of these health insurance companies making millions and billions. And then we've got the workers at the hospital barely able to unionize. I look around and I always tell my colleagues, I'm like, y'all, doctors should have been doing what nurses were doing and what physical therapists were doing and collectively bargaining and unionizing. But I think because, especially in medicine, and in particular doctors were run by white men who were the top of the system in the hierarchy. They didn't realize they were they were right. And if we had all worked together, we would not be in this situation with this broken healthcare system, you know? So all of this has inspired me. I use my services and my skills and my voice to do the biggest good. You know, you mentioned my practice several times. In full transparency, I am retiring myself early, solo private practice, because especially I think as women, especially as moms of children with special needs. And I also am neurodivergent. I have ADHD that was diagnosed as an adult. I think the weight that we have, there's documentation that shows that especially brown women, we have more of the lifting of holding people in the traumas that they have experienced before. Right? On my website for my practice, it's like, we are undoing the damage that has been done to so many people. So many people come to my practice being like, my last pediatrician didn't have time to listen to me, but I was worried about these developmental delays. And they told me, oh, do your ASQ, do your ASQ-SE, do your MCHAT, get on this waiting list, this 1-year waiting list for, you know, psychoeducational testing. And they just told me to wait, but I know something's up. And I have been there. Like, I have been there. So I think our system is causing many of us who have experience like mine to say, okay, in this moment, when this whole system, which is not even a system, it was broken before, but now it's literally crumbling in our hands. How can I make the biggest impact? And I had to go back to, like, I'm a really good teacher. I'm really good at teaching other people how to do it the way that I do it, how to navigate some of these systems. So I'm transitioning to a public health position here in DC to teach others and to bring this type of high level care and access to more and more people. So,
but I think that's super. I mean, what you're talking about is so powerful. And like I was saying, like, even in America, you know, we talk about, you know, the first world, right? Like I said, I'm from Trinidad. We talk about the first world. We talk about all these different things. Over the years, when we were talking about when I was getting out of school, and there was so much collaboration, and there was this, and we were excited. We could change the world, and we could do all these different things. And you're right, the system was broken then, and we are living in a completely different time of a system that we're like looking for the pieces. We're literally looking for the pieces and the crumbs, right? And that's what we have. And we are in the system. And we're saying that. So the people that are not even familiar with the system, the people that don't even know how to navigate, the people that are like, man, we are trying to like wade through this water and we don't even know what to do, where to go. We're going blind. We're trying to, you know, grab the straws here and there, and we don't know what to do. And I think, you know, your years of experience, I'm going to pull some of that out in this conversation for sure. But what I also want you to talk about is in the public health, what you're talking about is really the impact that you need to make is the duplication process, of touching these healthcare providers and changing this mentality of what we can do and how we can impact this in such a broader way, because there's so much that we can do alone, but together.
Yeah.
Oh
but
my
I just want to take a moment to say the United States has impacted the healthcare systems in so many other countries. And so some of the bad things we're seeing abroad were inspired by the stuff that was happening here.
What's happening here?
So the United States is the only high-income industrialized country that does not have a publicly funded preventative primary care healthcare system. Like, literally.
Which is crazy.
I'm like, entrepreneurship ain't gonna fix it. Like, little doctors opening offices here and there and doing good work for 100 people, 150 people, 300 people, 400 people. Y'all, it's not doing it. That was one of my biggest frustrations in private practice groups. I'm like, y'all, us just doing it for this 100 people, this 400 people, this however many people, it is not going to impact care in the way we want it. We are the only high-income country that does not have a publicly funded primary care prevention system. You can't base it on insurance. You cannot.
But do you think we can get there? Because I don't know that we can get there in
we spend more than everybody else.
Yeah, but you know, we live in a capitalistic society here in the United States. For now, you know, we don't know where we're going right now.
Crumbling too.
This is We're at a different time for sure. But we are in this space because, in Trinidad, for example, right? Or we look at Canada. My brother and his wife and stuff, they're in the healthcare field, they're doctors, right? They're having challenges as well. And it's not a
But
simple,
they don't spend nearly as much as
they
we do.
don't. But what are you willing to you see? The thing is, I truly feel like we have lost, for me, I feel that we have lost where the priority is. So people are
Why?
no longer priority, you
And
know,
why?
right? I think because there's always been an imbalance, right? Power, money, greed, all these different things. And I feel like we've had this delicate balance that we're trying to play. And now the balance is so lost. Because if you really think about it, insurance companies were put in place initially, right, to look at doctor spending, to control spending. Well, nobody was watching the watchers.
Hmm.
Nobody's watching the watchers, and they saw an opportunity to turn around and expand that. And you're saying, well, okay, well, insurance allows us to receive care and to be able to get all these different things, but they're prohibitive. If I go to the doctor's office and I can't even receive basic care because, well, it depends on if you can afford it, you can't afford it, who gets it, who doesn't get it. Even in Trinidad, my last conversation with my guest was about the fact that, well, they're starting to have services, but really only the people that can afford it can have services. So you eliminate such a huge population, but guess what? That
Yeah.
population still exists. We still need a deal. They're part of society. There's still things happening,
And we're all
right?
connected.
They're all
We
connected.
don't
They're
take care of the
resources being
masses.
need. My gosh. Oh,
Yep. No,
you're getting me
I
worked up.
hear
Oh
you.
my
But
gosh, you're getting
again,
me worked up.
we spend the highest percentage of our gross domestic product, and our health outcomes are terrible. They were terrible 10 years ago, and they're worse than they were when I started in medical school. So when are we going to say enough? When are we going to say this is literally killing us? I've got statistics from 20, 30, 40, 50 years ago. The United States, we were impacted more by COVID deaths than any other industrialized country in the world. You look at this life expectancy, our COVID was like bloop, and everybody else's was like a little blip.
Yeah.
So when is enough enough? I know
Yeah.
I know enough is enough.
Well, a lot of people are tired. A lot of people are tired, but they're lost. They're lost. So moving into the public health sector, though,
Mm,
what are you hoping to
mm,
what are you hoping to impact, and how are you hoping to impact that
mm.
change, to be able to create that bridge, to be able to start that turn, to be able
Yeah.
to do that? What are you hoping that you can create in that space?
Yeah, I mean, now that it's been so many years of doing this, I realized that there's so much power in just the knowledge of the workflows, the ways that I interact with patients, and teaching my students those things. I have an internship program that I've run since I started the practice. I always have two to, well, we started out with one, and then last summer we have 4 interns. And so my interns are now in med school and working in
Mhm.
nutrition. So it's always for me been about teaching others the way that my outstanding mentors and teachers taught me. So part of my hope in pivoting to public health is to be able to interact with more learners, to inspire them to do things in empathetic ways, to look internationally, right? If it's almost like a little seeds that you can plant in the different places that you're at. Like this conversation 10 years ago, no one was talking about how we were losing in terms of health outcomes. No one was talking about how the insurance companies literally are making millions off of our bodies and our death. And now we are.
Without the results to show for it,
And
mind
now
you.
we are. And
Right.
now every single place I go to talk, we're talking about this. We're
Yeah.
talking about international standards. We're talking about changing things. So I honestly am using my experiences to just share what I have seen, to share a broader message based on international human rights, right? The rights of children, the rights of family, the rights of women, the rights of men. So that is what I am hoping. I am hoping to help really start to broaden these conversations, because this little band-aid here and this little band-aid here and this little band-aid here, while we're literally hemorrhaging.
But I think that, to your point, though, wouldn't that also come from the way in which we are training from the very beginning. So when you talk about the internships and stuff like that, you're dealing with them from the very beginning before they get out. So these programs that we're doing, so from a public standpoint, we got to change how we're producing and putting out these individuals, because these are the thinkers, these are the people, because when that force comes out, when that force has the impact, the policy changes. When that force comes out and start lobbying, you know what I mean? Those are the things that create change.
There are some concerning developments with that, right? So like I used to teach at GW, and it's really expensive to educate these students. We're seeing less and less, like a lot of schools around the country are decreasing the number. Like, so first of all, let's start with, we've had a doctor shortage and a nurse shortage for decades. We have less practicing physicians per individual than any other, again, high income country. So we've just got less doctors and less nurses to start out with. And then you get into the impact of burnout and COVID and things like that. Just looking at that, that's pretty bleak. So yes, some major changes need to happen, right? We've got major changes in debt management, right? We've got, most of my medical school class, we left with hundreds of thousands of dollars worth of debt, which that contributes to burnout, right? So yeah, it impacts all of the training. So yes, when you talk about, I mean, I would love to see, for example, just like I know some of the schools are shifting towards decreasing the amount of time people are in the preclinical years, increasing the time of like apprenticeships and things like that, and internships and shadowing. But the problem is that you're asking people like me in private practice to volunteer our time. I was teaching medical students at GW for several years, and it got to the point where my team had to be like, Dr. J, you can't see patients because you're volunteering to help these students out. And they were like, you can't anymore. And my husband intervened and said, I know you love your students, but you're volunteering. And then when I contact the school and I say, hey, you're looking for more diversity in teachers, but you're not compensating us at all. We've got childcare and we've got businesses that we're running. And they're like, yeah, our payment structure is not set up. So if you're not affiliated with one of the big institutions in our area, you're not even compensated for the hours and hours and hours you work with students.
But this is significantly impacting what we produce, what we're putting out.
Huge. It's so huge.
Where is that money being funneled to? Because there's definitely money coming out. That's the reality. I don't know.
I follow the money, but that's not my expertise. That's not my ministry, as they say.
But but this is where people are frustrated. You know what I mean? It is where people are frustrated, because if you're putting out the effort, the energy, all of these different things, right? And even from a parent perspective, right? Even from a consumer perspective, you're going in there, right? There's certain expectations, you're coming in. And if you're not able to be in a system like this, where you're at a vulnerable space. It's such a vulnerable place to be this broken and to be this in crumbles in a space where, and now you have these kids who you are fighting for
today. They've got needs today.
They need that today.
And they're having seizures today.
Right.
And they're getting kicked out of school today. Like
every day, every single day. And okay, so, let's just jump into this right now, because we're talking about this already. So like, the climate right now.
Yeah.
Right? The climate, my concern is that we are going back to institutionalization. We're going back to this space of where infantile psychosis was the thing, where we separate kids and we think that, these kids are broken, or these families, you know what I mean? And we need to turn around and put all of them in homes and take them away from society, and they can't be functional members of society. And we know that's not true. There's countless examples of that not being true. And I feel that, and it's so many, because I've worked from the kids, infants, all the way to geriatrics. And I feel like on both sides of that spectrum, we're seeing the same thing. We're seeing the same thing happen. Like geriatrics, we're starting to push them aside and be like, I mean, they're old enough. They can, if they die, well, they lived, didn't they? Like, and this is so sad to see, and I don't know. That's why I said to you, I feel like we're losing our humanity, and that thinking is driving where we're going, and it's just getting worse and worse and worse.
So I will say that if you pay attention to mainstream news, you may think that. But what I see every day working in the community is people are figuring their things out on their own. Mutual aid society, parenting groups, you know what I mean? Like, we are creating the communities that we need. So, for example, the office that I'm in, this is my garage. We converted my garage into an office with a community gathering space and a professional office because I wanted a space where I could bring my patients together and we could learn together and we could gain skills. I've had cooking classes back here. I've had yoga classes and meditation and parenting groups and lactation groups. And I see so many people doing that, building what they need because the system is not providing for us. So I don't think, yes, I think from on high, certain people are very ableist, very sexist, very racist, very xenophobic. Like, we see it in the policies that are coming out. But I see people fighting back against that. I see families representing themselves online. I see books that never had neurodiverse children, right? Like, I don't remember ever reading a book other than like Helen Keller, right? When you know what I mean? Like, but I never read anything about anyone with autism or someone with Williams syndrome or someone with ADHD. And now we are. Like, honestly, every single week I'm talking to people who are pivoting and using their voices in positive ways to combat what you may see in the headlines. And a lot of us are also just like tuning out, right? Like, I'm about to take probably a year sabbatical from social media. Because I'm like, I got real world work to do here in my family and here in my community. And I'm taking my power back so that those headlines that I see online every single day, something else coming out from HHS that makes me want to like throw my computer, so that it's not the only thing that I see. So I think we all in this moment have to be very intentional about where we pay attention. And I think so many good things are happening that we have to be intentional about focusing on those. Because it's also a tactic, right? Like, if it looks like everything is crumbling, you don't know that people in your community, your neighbor next door, the other special needs mom down the street is making groups. You don't pay attention to those things.
But I challenge in this respect. While I agree with all of those things, because even though, like right now, even the reason why I'm doing a podcast or whatever the case is to have the real conversations to try to pull out some of these things, right? The thing about it is that the need to continually have to create and pivot and shift, while that allows us to create and fight, because I always talk about we have to be active in our own rescue. We have to be active in our own, because we have become a very
one's
passive.
coming to save us.
That's right. But even if everything was okay, even if things were working better, I still believe that it doesn't warrant that we be a passive, you know what I mean, participant. I believe in being an active participant in that space. However, the reality of the situation is that there are things, you know, and I'm not even talking about just the differences that may be happening in HHS, because today something changes, tomorrow it changes back. Today something changes, and like a week later something else changes. And you're right. It's these organizations that have had to find new ways to be able to do this. The big thing is that people have to get engaged. But there is a fatigue that happens. And the fatigue is what's going on, and the overwhelm. And I think that what you talk about in the intentionality is so important. Like, I am very intent. I am not big on social media. They laugh at me very much because I am like, I am not, because I'm very intentional with what I listen to, what I surround myself, who I surround myself with, right? And because I believe in, you know, you have to protect what you put in, because what you put in is what comes out, right? And so I'm very particular with that. But these parents, what happens is they're searching. So whether it's groups of individuals or whatever the case is, doing that for a short time is one thing. When you are fighting on every single battle at every single point, that's a lot. What I'm hoping to create through my podcast, through referrals, through interactions and collaborations with people such as yourself, especially you're moving into public health, you better believe I'm going to be a tick on you. You know, is to be able to help them make that process more accessible and weed through the noise that is distracting, you know, that is distracting them from caring from their kids. Creating a life that can be extraordinary, but just different from what they originally had planned. right? Because I truly believe it's possible. I said it at the top, you know, this thing that people, because you have to be careful. If I sit here and said to you, for all your life you grew up and you heard you are broken, you're broken, you're broken, you're broken. The reality is you're going to break up thinking that you're broken, and you're going to need a recalibration of that thinking, and that's what I am fearful of, is because it's to really get people to understand they need to be intentional, because they cannot just allow information to slap them. You remember when you used to go to the library and have to search things out? You know what I mean? We have so much
I
access
loved
to
my little
information.
cards.
The
My
cue
little
cards, all the
instant
cue cards.
cards.
When you were
I love a Dewey Decimal System. Oh my
the
goodness.
Dewey Decimal System,
I
yes.
love
Half
the
people don't even
library
know what
stuff.
that is, but yeah, that's our time. You know what I mean? Don't
Yeah.
let these faces fool you. We were back there.
We was there. We out there. We outside.
Right? But so what are some
Mm-hmm.
what are some things? Give me some tangible things
Yeah.
that you feel like you can tell parents, because I know you do parent classes,
Yeah.
right? You do all this community type outreach. Talk to me about some of the things that you share with them that are truly impacting and changing how they see their world and feeling empowered in their space. So what are some of those things?
So I am big into organization as like an operations. I won't call myself an expert, but I love me some operations. And so my team and I last summer organized, we did a starter guide and a full guide for families that had new medical diagnoses, because I knew how to manage it as someone with a ton of experience, but no one gave me anything that was like, do this,
Mhm.
and this. And you get this new diagnosis and you're like, oh my God, let me go on the internet. And then you're freaking out, right? So I guess I'll go back to like my son when he was diagnosed. So my son, who's now 7 years old, almost turning 8, I knew when he was first born that something was going on. And I had that experience where everything's fine, Miss J, he's fine, everything. I'm like, first of all, I have already had a natural birth where the baby was almost 7 pounds. This little one is 5 pounds. Like, first, let's start there. Then I'm like, he's got signs of dehydration. And I know I'm making some milk. And I know he is nursing. And I know he is excited to nurse. Miss J, it's fine. Just keep supplementing him. Well, wait, because I'm lactation medicine. So I know that if I'm making enough milk, he shouldn't be showing signs of dehydration. So my pediatrician kept being like, everything's fine. Just keep doing the supplemental bottles and all this stuff. And I'm like, I referred him to early intervention when he was 2 months old. Let's talk about trauma. It does not feel good as a mama to be like, my pediatrician won't listen to me. I'm referring him to early intervention. Then my little sweet peanut ended up having surgery, and I knew the team, because it was where I trained. And the surgery was taking so long. And I was like,
What's happening?
something's
What's happening?
The surgeon has already come back and said he's done, but anesthesia hasn't come back. And I'm like, and I know I talked to anesthesia before. That child should not have gotten a narcotic for this simple procedure. So then an hour later, then they were supposed to, anesthesia comes, Dr. Burton, we're so sorry. He had respiratory arrest. We had to reverse him. Reverse him for what? What did you give him that you needed to reverse? We gave him a narcotic and he went into respiratory arrest, and we had to give him multiple reversal agents. Okay. Red flag number 2. Tone issues, like all the things. So I'm sitting here in the doctor's office crying, like,
and you all, and this is the thing, though, you are.
I told you,
gosh.
This baby needs to see. I asked for cardiology and genetics when he was 3 weeks old. I was like, y'all, I got a lot of experience. This little baby needs to see genetics, and this little baby needs to see cardiology. You should listen to me. No, Dr. J, he almost died. And let me tell you what it took to get the referrals. One of my preceptors, someone who supervised me when I was a rock star medical student, came in and saw me crying and said, Jalan, what is going on? I said, girl, I know my stuff. And no one is listening to me.
Wow.
And she said, they should listen to you because I listen to you. And I'm like, I know, I told them. And she tells me to ask for a chart review, because within the healthcare insurance company, I won't blast them, but I think they're a little terrible. You have to get a referral from your primary care doc to see any of the specialists, but you can ask for a chart review, and they will get a chart review from the specialist that the doctor, whoever sees. Within less than 24 hours, genetics got his chart. Well, so first of all, then the white male doctor says to me, how do you know about a chart review when he comes back in the room? I say, because I do, and that's what I want. And he says, okay, we'll go ahead and get that. And I'm like, yeah, we should get that. Within less than 24 hours, genetics was like, please bring him in next week. We're going to add him to the schedule. I had my diagnosis of a rare genetic syndrome called Williams syndrome. I had it within 2 weeks. And they called me on Friday at 3, which is not supposed to happen, right? Like all of my training is like, you don't give people these life-changing diagnoses. Before Mother's Day, before Mother's weekend, 3:00 on a Friday, they call and say, we didn't want you to go into the portal and get the results. Your baby has Williams syndrome. We can make an appointment for you within the next 2 weeks to come and talk. So my husband and I sat all weekend huddled, crying. My in-laws happened to be in town, and having the training again in connections, the head of genetics at UNC was one of my mentors, my dear mentors. I texted her. She texted me at 1:00 in the morning from Greece. Call me right now. Don't cry by yourself. And she just talked to me for an hour about Williams syndrome, about how often it gets missed until later. The fact that he was diagnosed at 3 months was super important. And then she helped me with who are the specialists that you need to see next. So from that experience, I was like, there should be something easily available for people. Like, you've got this new diagnosis. What are the steps that I take? And so that's what my team and I did. And so I put everything into this guide. Like, I use, I because of my neurodiversity, I use visual reminders. So I always do a head to toe with kids. Like, it's always head to toe, so I don't forget anything. And so I've got a little boy character that our artist designed. So it reminds me: school, neuro, eyes, ears, throat, speech, cardio, pulmonary, right? I've got exclamation marks, like, make sure you check in with cardiology first. You know what I mean? First. So the guide it really takes you through step by step, staying organized. Talking about things like having a family email address. It's not my personal email address. It is my family email address that my mom, that my husband can help me with. And if your best friend helps you, or your mom helps you, or whoever, you guys have the shared email address for the family where everything that has to do with the kids come in.
Everybody knows what's going on.
Everybody knows what's going on. But if I didn't have a background in operations, never would have even thought about that, right? So every single time I have a meeting with someone, including my podcast interview with you today, I have a note here: 0115, take 2 Dr. Vivienne podcast. Every time I have something for my son, I've got my 2026 Google Doc. I've got my 2025 Google Doc. I've got my education heading. I've got my medical heading. I've got my school, I've got my summer camps. And that is how I keep track. But people you don't know.
Yes.
You don't know. And so I developed that guide. So over the next year, my goal is to make these guides even more accessible to people. Part of the pivot to public health is I can't see patients full time and try to get my guides out there and try to do my parent coaching. It's just too many things to hold.
It's a lot.
And I'm like, you know what, y'all? Let me teach the next generation how to do the primary care, and let me go into how can we make these things more easily available.
Accessible.
All right.
I want to highlight a couple things, though, because what you just shared is very, very powerful. There's so many things. There's so many learning points in what you just shared, because at this time you are already a doctor. Okay. I just want to highlight this. I just want to highlight the
doctor with 10 years of experience.
Okay.
Who was phenomenal at the time that she's telling people.
And you're pleading with the other doctors to pay attention to you in this field that you are a doctor in. So the person that has zero medical, you know what I mean? That's just the parent gut. Initially when you started talking, I was like, this is not just the doctor gut. This is the parent gut. Because you know the mama gut. You know the mama gut. When the mama gut sings, it is strong.
And I take it so seriously.
Right?
And I don't think that is not taught enough, right? Minimizing the parent concern. No. this mama, this daddy, this grandparent is with them every day. They are the expert of this child. Any of my patients, they're like, I'm worried. I'm like, girl, I'm worried too. Let's go. Let's figure it out. The parent gut and my gut, I let them know all the time. If you are worried, I am worried. And if I am
Something's
worried,
there. I
will
gotta
tell you.
decipher what that is.
I will tell you.
As a physical therapist, that's exactly right. I tell them all the time, dealing with the kids and stuff. I said, you are spending 24 hours a day with your child. You want me that's spending an hour
Yeah.
twice a week, if an intensive, maybe 2-3 week spans, to be able to be more knowledgeable about what's happening or what may be happening with your child. You can pick up on these things so quickly. I did an 8-week parent empowerment program where we're highlighting these different things, trying to empower these parents to have more confidence in what they bring to the table in these conversations and being their own advocate, right? And being more active and not this passive and just defaulting because they bring something to the table. So that was the first thing that I heard you say. And I was like, please let me highlight this because that is huge. And the fact that you're going through these different things and you're reaching out. And the other thing is that for you, you're based on your community, your team that you were reaching out to, right?
Yeah,
and we talk about parents, about bringing your team together. And who are the people that's your team? And it's important because not everybody can be part of this team. And being very particular about who you allow in the team because there are people who may not be appropriate for your team. That's just the reality. But one of the things I want to ask is this. When you were talking to the pediatrician and doing these things, and I know there's a lot of rare things, there's genetic things, there's all these different things. Is there some kind of specialized training that happens in the pediatric world when it comes to these rare diagnoses or, being able to really highlight these things with these kids? Because these parents that are coming in that's saying, my pediatrician keeps blowing me off or whatever the case is. I'm like, I hear you, but I feel like this is happening more regularly than it should. Even if you say,
I think they're busy. I think they're so busy. I think they are so busy. And these meaningful use things from these insurance companies, the pressure from these insurance companies and these medical executives, it is at an all-time high. Like
it's the reality of the space that we work in. It's the reality of the system that we have had to work in. That is the reality. But that's why that's why the parents have to be advocates. They have to go that extra mile. They have to push that envelope. They have to go and dig deeper. The person that I spoke to in Trinidad, for example, and I'm referencing this because I just did this and I'm just giving some global, comparison as well. Yeah. It was a pediatric psychologist who said, you need to have more testing. Not the pediatrician, because she kept saying something's going on with my child. This is what's happening. This child is regressing. Because her other siblings had kids around the same time and they're doing this and she's not doing this. Something else is happening. And in Trinidad, the education around this space, they're now coming out and doing some stuff, but it was really lacking. Super behind what we're doing right now, right? I'll give them props because they're starting to catch up, but they're still super behind. So what they were dealing with, but I'm seeing a pattern that happens, right? And some places where I had another guest on, and she's from Arizona, another pediatrician, and she said they have now institutionalized. There's a specialized training where they are now under that envelope so that they now can be categorized as a developmental diagnostic pediatrician.
Yeah,
and so they have.
Yeah, but we tend, again, going back to, we don't have enough providers, period.
Sure.
Now we're super specializing even more. Who can show me that all these specializations and certifications have improved any outcome?
No. I say this only because when you talk about, like you said, you were pushing the envelope with the case studies, with the with the chart review and stuff like that for the geneticist, right? Like you were like, I need to see a geneticist. The average person may not understand who they need to see or whatever the case is. But if another pediatrician is like, listen, I know something's going on. I just don't know exactly what that is. But who my referral people are and who I need to create as part of that team. Because I think that in the system that we operate in, the reality is, you're right. Yeah. The system does not allow for some of the things to happen. It's the same things I say about, the IEPs and the school system. Yeah. What sometimes they want out of the school system is not possible. That's part of this. That's part of the breakdown of what people and the frustration people have with that system. It's just not possible, and that's not the space for it. A referral to another space should be given, and we're missing that gap. We're missing that bridge.
If your doctor is not listening to you and you have pointedly said, I am worried about X, Y, and Z, I'm okay with waiting a month. But they should be like, I'm going to call you back. We're going to do a follow-up in a month. And if it doesn't happen, guess what? You got to choose another pediatrician. And you got to have somebody in your family who's good at writing letters. Write a letter. We have told this pediatrician multiple times we were worried about X, Y, and Z.
Yeah.
And they did not listen to me.
Again, the team.
You know, I fired that doctor. The doctor who didn't listen to me. Once we found out about his diagnosis, and it wasn't that he wasn't nice, because he was nice. He was a nice guy. But I told you repeatedly that I was worried, and you didn't listen to me.
Yeah.
Now, every time I come in here, I'm worried about what you're going to miss.
Yeah.
And so I said to the receptionist, I said, give me the oldest doctor in here. I don't want anybody that's my age. Because also, I know my shit. And so, I think I was making him a little nervous. Whatever.
Yeah.
If I'm making you nervous, get a second opinion. You know what?
Thank you.
What? This doctor mom keeps saying that I need to do genetics and cardiology. Let me go ahead and refer her so she can see that everything's fine. Do the referral. Did he do it? He didn't.
No.
My baby almost died in surgery.
No.
He didn't listen to me. And so I fired him. Do we still, when I see him in the hallways, hey, how you doing? Good to see you.
Sure.
And I'm going in here with this other doctor. Now, I even had to, even with her, I saw that Williams syndrome is so rare that the local doctors were behind on stuff.
Sure.
So I'm reading reports and they're talking about getting CT with contrast of his kidneys. And I'm like, but in the literature, kids with Williams syndrome have very delicate kidneys and you could destroy his kidney and he could need dialysis if he needs this. And I said, y'all, I've read all the reports. I don't think he needs this. I was like, I think we need a second opinion. And they said, well, we're doing fine here. You're behind on the literature. And so Williams syndrome is one of the syndromes that we have 9 centers of excellence around the country. So then I said, y'all, I think you need some help. I want to prevent things before they happen. I would like a referral to one of the Williams Syndrome Center for Excellence. And I think at the time we were really worried about his aorta and this condition called mid-aortic syndrome. So I found out who was the expert in this country. And I said, I want a referral to him at the Williams Syndrome Center. They denied it. We wrote back. They denied it again. Then me and my husband's a professor. He's a PhD professor. We wrote a 17-page letter, I think. And then
all right, shout out to hubby right here.
And then they approved it. And then they told us we could go the next week. All the way to Boston. So my mama, my new baby who was nursing, and my little baby, my toddler who needed to go, we all went, got us a hotel, spent thousands of dollars, and went overnight and got the support that we needed. And every 3 years now we go. Well, now we switched to Children's Hospital of Philadelphia, but now we go. So again, I know my stuff. I knew that if I keep pushing it enough, they will cover it. But the sad thing is, I see on these internet groups, these families that don't know, and then the babies die while they're waiting on the authorization. I had to take a 2-year break from social media when our middle was, I think he was 2 or 3, because it was every other week I was hearing about another baby with Williams syndrome who died because they die of heart failure and respiratory failure and when they're infants.
Okay.
And on these groups, these moms are like, she's in the intensive care unit. She's on ECMO. ECMO is the extracorporeal oxygenation. So you're a machine and
blood comes out.
And the lungs
blood
for these
back
babies.
in.
It's really hard to get off that and be whole.
Gotcha.
Because the damage it does on your body is significant. Every month I was hearing about these little babies. And so many of the times they were little brown babies. And I'd be in the DMs like, hey girl, I'm a mama who happens to be a pediatrician and I'm scared What you have shared is life-threatening. You need to get a second opinion. Tell the team they need to reach out to one of these Williams syndrome clinics and get your baby there because I'm scared and your baby may die. And so many babies kept dying. And I was like, I'm taking a break. And I took a 2-year break when he was little from social media. And I'm about to take a break again because it's just, you can see it, right? In the story. It's like, I'm waiting on authorization from the insurance company. I'm waiting on the second opinion from the hospital. And in those moments, you're like, that baby's heart is in heart failure.
Yeah.
Like, I would be paging. I would be, but I know how to navigate the system, right? I know I'm about to page cardiology on call at the hospital where I need, and I'm sending an email. I need your response by tomorrow. But yeah, the average family doesn't know that. And so
that's right.
You know, some of the work, some of the uncompensated work that so many of us do in these parenting groups is I'm sliding in your DM. I'm putting in the comment, hey, this is an emergency. Check back on post XYZ. That baby died. You need somebody to handle it now. And so it's scary because, right, that could have been my baby. That could have been my baby.
Yeah.
Could have been my baby.
That is such a... Thank you for sharing that, because that is such a deep reality for, for these parents in that space and what they feel. And as they're in the groups and they are seeing kids that pass away and they're trying to support each other, but they're still trying to protect, their heart, in that space that exists for them,
And I'll still text the parents, right? Like we still have a group chat, like we have a local group chat of parents of children with Williams syndrome. I'll stay active on that, but like I'm not going to be on the Facebook group. Like, and you know what I mean? I'm going to post on there, hey y'all, I'm taking a break. If you need me, catch me offline, text me, call me. I'll be there. But for my mental health, I'm like, I'm just going to take a break.
Yeah, you got to take a step back as well. As a physical therapist, while it's not like do or die in that moment, I get a lot of questions around navigating the system or, hey, what can I do? And I'd be like, and sometimes even for me, I take for granted, no, well, that doesn't even pass the sniff test. I tell them, I said, has it passed the sniff test? Because if it isn't even passed the sniff test, oh, okay, hold on. We need to turn around and do XYZ ABC. Did they follow up with, with this doctor, or have you seen a ENT, or have you seen or something like that, or have you seen the GI? Well, no. Well, they're just saying, well, okay, let's not get ahead of ourselves. Oh, wait, they say that you can't get off the trach. If you get on the trach, well, why would that happen? Like, what's making it such that you can't get on? Have you asked this question? Like, you know what I mean? Helping them find out, what are the questions? Right. What are the things that you can take back to your doctor to be able to ask to get that? So maybe the real thing is there are times when we create a blitz. Maybe there are times where in this journey, parents need to have that blitz mentality where something has happened and you need to be like a dog with a bone. You know what I mean? Like you are just in there and you are just, you know what I mean? Because you can't keep that, like I said, keeping that level of intensity.
It'll kill you.
Exactly. I talk a lot about parents and self-care and being able to turn around and do that because, as good as you are and your kids feed off of you as well, all of the things. Yeah. But the blitz mentality, like you said, like, something's happening. No. I'm in mode right now and we need to go. Like, this is blitz mentality. What do we need? Mom? Dad? Puppy?
And that's when sometimes you phone a friend, right? Like it could be you've got a neighbor who's a social worker and you have her sit in on the call with you and say, this is my cousin, right? Like I've been a part of so many of these conversations for people. I'm not their doctor, but I'm a member of their community. And I just say, tell them I'm your cousin.
Yeah.
Tell them I'm your cousin and I'm listening in. I'm sure you've been part of that too, right? Because as soon as they hear your cousin, the physical therapist, people act right. They get some act right, as my grandma would say. So, hey, my cousin, the pediatrician, is going to join this call. Like I've been on end of life calls with patients, parents, and their dads were dying. Like it had nothing to do with the patient, but it was like, Dr. J, they are throwing a lot of words around and I don't understand it. Tell them your cousin Jalan is going to be on the call and she's a pediatrician. And they act right. And I talked to them after, they're like, girl, they ain't never explained stuff like this to me before. Okay, get you a cousin. I don't care who it is. It's the retired English professor in your neighborhood. It's the nurse at your kid's school. It's the grandma who used to run the nursing unit at the
They know the
rehab.
jargon. They know the game.
Get
They know the
another
in and out.
person. They don't get them. I don't go to a single meeting for my child where my mom or my husband, my mom's a social worker, where my husband's not there, who's a professor, or my mother-in-law, who's an ex-professor. I don't go to a single meeting where they're not there. And they don't get included, include them. So find someone else just so they know somebody else is watching. Somebody else is
bringing that other perspective. That other perspective. That question that you miss.
Ask that person. Say, please ask at least one question on this phone call so that they know you're in it. And again, it could be anybody in your community, but don't go to these meetings by yourself. And you can even, like, when I go to his appointments, and when my husband takes him or I take him, we call each other on speakerphone. Hey, she's got a meeting at this time. Let's connect at this time so she can talk. I ask my questions. Hey, babe, anything else that you need to think of? Half the time, we don't even have a question. My wife's seeing patients. Let's loop her in between her break. And we do the same thing. So everyone, I think one way to start, every single time you have a concern, tap a phone a friend. And just tell that person beforehand, hey, I'm going to see this doctor. I got concerns about X, Y, and Z. Please help me in this call. Because again, they act right when they know somebody else
I'm
is
laughing
there.
I'm laughing because I do so many of these. It's not funny. That's why I'm laughing. I recently did one because my aunt, unfortunately, recently she had a stroke. So she had a second stroke, but after the first stroke, it's the same thing. She was telling me some things, and I was like, what is happening? What is going on? I said, you know what? No, we need to get in touch with your doctors and your therapists. And what are you talking about? You haven't had therapy. What, once every 3 weeks? What is that doing? This doesn't make any sense to me. Like, get them on the phone.
At home deconditioning.
I'm like, what is happening? I was like, get them on the phone, and we set these things up, and we talk through. So I was the doctor, the therapist, the PT, the speech therapist, the OT, and you start asking these questions, and suddenly they have the answers. Oh yeah, we could totally do that. Oh yeah. No. She totally should be seen twice a week. We should totally get her on there. And if we don't get this person, we should get this person. Yeah, that would. You know what? Thank you so much. Thank you so much for that. You understand the game behind the game. And
that's the game. So yeah, I would say start with that. Don't have any of these appointments without somebody else on the phone.
For the audience, that if you were sleeping at any point, I hope they just heard what you just said, because that is gold right there. That is gold. I never really even pull that out, but that is super, super gold right there, But go back a little bit, just really quickly. In your practice currently right now, you are doing a different model. I want you to talk about the model, because you know what I mean? I want you to talk about the way in which you were treating patients and really creating value to these families that love you, and probably where you got that name Mama J from. So talk to me about that kind of system.
So you don't get a lot of training in any different kinds of medicine other than academic medicine and private practice. That's it. That's what I saw. But when I started practicing, I was like, everybody's really burned out. People got to be doing something differently. And so I just started applying for grant funding, and I got accepted into this program from the American Academy of Pediatrics for early career physicians who were interested in doing a research project, interested in practice management, all this stuff. And so you could choose any project you want. And I just happened to choose alternative practice models. Because again, my background in public health was like, what we're doing is not working. What we're doing, people are getting sicker. Let me see how people are doing it differently. So I talked to friends who are getting care in the UK. I talked to people in the Midwest. I was literally just cold calling people and submitting things on their websites oh, you have a concierge practice. What does that mean? Nobody's ever taught me about that. What is direct primary care? And I kept getting back to this direct primary care and concierge where let's get the insurance companies out of the room, because we know that 45% of our increased costs in America are related to healthcare administrative costs and insurance costs and waste. And I was I just kept going back to that. And I was working at the time, I think, at a federally qualified health center where I always thought I was going to be working my whole life, but then everybody's burnt out and overwhelmed, and the appointments are 10 minutes and 20 minutes, and the people are getting sicker and sicker. And I was just I'm not doing this. This is dangerous. Y'all not about to take my license. This is not good. I'm not going to be here anymore. And I worked for DC Medicaid for a while as one of the executives. And I was like, yo, y'all need a house call doctor. You're telling me we're spending millions on hospital readmissions, and half of it is just like we had these visiting nurses and then visiting social workers that would go in and it'd be like, yeah, they're on the wrong meds, but I can't get in touch with the primary care doctor to get the meds updated. And I would be in these meetings where they're talking about millions of dollars and billions of dollars. And I'm like, yo, y'all, why don't you just let me go be the doctor for all these people? I'll be like the hospital readmission guru. I'll go in, I'll look at all the meds, I'll call the social worker, tell her what we need, I'll call the pediatrician, tell the pediatrician what we need. I can write the orders, I can cancel everything that they don't need, do all this medication reconciliation. And everybody was like, no, that's not how we do it. That's not how we do it. That's not how we do things. And I said, but y'all, this could be a game changer. Like we could do like a pilot program where we show we've got this Medicaid doctor who goes around in her little Kia and goes and keeps these kids out of the emergency room. And they said no. And I said, well, let me go do it by myself. And I launched my practice out of a little, Target plastic drawers. I had my bag and I just was like, I just launched in 2019. I was like, I'm doing it differently. And I had already made enough connections with people all over the country that I had people who were willing to help me figure out how to do it. I had nurses who I worked with before who were figuring out how to do it. And I did it. And it was, the insurance company has nothing to do with us. You pay me this fee and I'm going to get you right. And you're going to be able to call me when you're worried. I want you to call me when you're worried. You are worried, you call me. That's what I train my patients to do. And they're so respectful. I don't know. I get a handful of calls and I want those calls because I kept you out of the emergency room. I kept you out of urgent care. Or I called urgent care or I called the emergency room to tell them you were coming and tell them what I'm worried about. That right there will cut down on so many unnecessary deaths, unnecessary ER visits. It just that right there, the physician having enough time to make some calls and do care coordination. So that is what I'm pushing for as I pivot into public health.
Hold on. Are you telling me that if in fact we had a system where the physicians or the healthcare providers, let's just say healthcare providers in general, were able to spend the time to listen to their patients, get a proper history and hear what's happening and be able to coordinate the care that they need and answer the relevant questions, then maybe we could decrease the cost related to future treatment and maybe prevent other complications from happening?
Vivienne,
is that what you're saying?
I am, but I also am saying I'm gonna have to go, girl. We are almost we're over time.
Oh my gosh, this is just crazy.
And I gotta take these kids.
I hear you. This has just been amazing.
That's a moral imperative. It is our moral imperative. People are dying.
Yeah.
People are getting sicker. Y'all, we can't. We see what's happening. The writing is on the wall. The system is killing us. We are morally required to figure out how to do this. Yeah. For our children, for our children's children, for everyone. We are all connected. So I want to make sure, like, again, we are all connected. Our health is all connected. If you are better, I am better. If your kids are better, my kids are better. We're all connected. The kid on Medicaid down the street versus the kid on the private insurance, we're all better when people are healthier and have what they need.
Dr. Jalen, listen, I could talk to you for hours and hours, obviously, because we're already over. Like, obviously, we're getting lost in this conversation. But
I'm going to music therapy. I have to take the middle kid to music therapy.
Oh my God. I am just so... Thank you so much for coming on. Guys, we got to get her back on here at some point. But thank you so much. I'm going to be following you. I'm going to be following up because I want to be able to give our audience some of those links to some of those things that you were referring to. And we're definitely going to get back together. But thank you for your honesty, your leadership, your heart, all the things that you're bringing to this space, because I know that the things that you are moving towards is going to change the space and is going to really really transcend what we're trying to do here and change the lives of so many people. So to everyone's listening, guys, today's conversation is only the beginning. Let's get this done together as a community.
Yeah.
Let's change lives and let's really, really put and be active members so that we can help each other thrive. Thank you so much. As usual, we thank you for being part of the Breaking Limits podcast. Like, subscribe, comment, put your comments down so we can get back. Dr. Jalan, tell people very quickly how they can get in touch with you with your Instagram or with any of your social media or with however. I know, but
Harmony
however.
in Practice. My website, as I scale down my Healthy Home Pediatrics, Harmony in Practice is my main website. That is where I'm going to make sure to have all the things that I'm working on.
Okay.
I'm taking my social media sabbatical, so I will make sure on there it'll say I'm taking a sabbatical, but this is how you can get in touch with me.
That's okay, because we got to be able to keep in touch and see what you're doing, because you're doing some big things and we want to know. We want to be right there with those things that you're doing. So thank you so much and take care. Blessings. Take care. Bye-bye. Oh my gosh. So guys, I just wanted to jump back on here and really that episode, if you guys have not tuned in to the episode that we just did with Dr. J, you guys definitely need to do that. We really went into where we are as a society as we are looking at healthcare, navigating the healthcare system, the things that we can do within the space to take back control of our health. And as parents of kids with special needs, what you can do to turn around and be that advocate, that warrior parent that you guys continue to be and live that extraordinary life. Some of the things that we highlighted were big on, creating that team for yourselves, creating that team of individuals that surround the things that you guys are doing, so that you guys have the support, but also that everybody's connected so that you have the different perspectives, that when you're at the doctor's offices, that nothing's being missed, the questions are being answered, and you're getting enough individuals that are having those perspectives to make sure that those questions that you need are being answered. And sometimes, you know what? You got to stay the course. The being very, being, right in there and persistent. That's the word I'm looking for. Being very persistent in that space, you know what I mean? And making sure that people are listening and people are hearing you, because that parent that we talk about, knowing that something's wrong, knowing that this needs to be addressed is very necessary. As I said earlier, as a parent, you guys are spending more time with these kids than the providers are. Your perspective is undeniable, right? Don't be afraid to bring that perspective to your appointments. Don't be afraid to bring that perspective to these groups, right? And learn from each other, learn from each other's wins, from the losses, from all these different things that are happening across these different levels. People are dealing with a number of different challenges in this space within the healthcare area, whether it's the policy changes that are happening, the insurance challenges, whether you may be getting cuts in funding or you may be getting additional funding, where they're reallocating resources. But what is undeniable is that there are still people out here that are working to help you navigate this time and these areas so that you guys have the resources that you guys need. This is why we're creating this group. This is why we continue to work with these experts to be able to find these resources for you guys so that you guys have guides and be able to have step by step and be organized so that you guys can better weed through the noise and find those solutions for you and your family. So thank you again for joining us today. Dr. Jalan, as she said, she had to run off and she has to take her child to music therapy. But we are so thankful that she was able to join us here today to be part of this special session here and this special episode. So again, Breaking Limits podcast, not just a show, a space where we are looking to support you guys on this journey with special needs families. And we would love to hear from you. We'd love to hear the challenges that you have. We'd love to hear the things that you need answers to, the stuck areas that you may have, that you need solutions, that we may have different individuals that we can join as part of your team to be able to find those solutions and really help you navigate some of those areas. We also want to celebrate your wins. So please feel free to share the wins that you guys are having, whether it's for yourselves, your families, your relationships, all of the above. We want to be on this journey with you. You are definitely not alone. So another episode of the Breaking Limits podcast, where we are rewriting that life, where possibility and hope is here to live an extraordinary life for you and your families. Take care. This is Dr. Vivienne signing off for yet another episode.